the 6 years since I signed the Affordable Care Act into law, millions of people have bought affordable health insurance, and many of those bought it for the first time. Last summer, we learned that for the first time ever, America's uninsured rate has fallen below 10%.
Donald Trump may claim he's not a politician. That's ridiculous. One does not reach certain positions in life without knowing how to play a political game. As he barrels toward a possible GOP presidential nomination, there can be no doubt he is becoming a politician. And eventually, all politicians have to stop spouting the same invectives and cliches and get down to business issues, something Trump critics have been waiting for. Now, Donald Trump claims he will ensure a replacement for the Affordable Health Care Act. But he's really offered zero specifics until now, with a slew of policy proposals released yesterday that are being dissected to see if they have meat behind them, or like so many other offerings from true politicians, are little more than sandbagging until the election is over. Now, you've just heard President Barack Obama react to Trump's announcement, in a sense. Now let's see who has the upper hand. We're joined by the president and CEO of the Pacific Research Institute, a nonprofit advocating for personal responsibility and individual liberty, Sally Pipes, along with the former lieutenant governor of the state of New York and health policy expert, Betsy McCaughey. Ladies, I want to thank you so much for being here. And Sally, I'm going to go ahead and begin with you. With what Donald Trump has put on the table here, is there anything here really shocking?
Well, I guess, he's been all over the map. One point he supports the individual mandate. He supported single payer. Now he doesn't. Now he supports repeal and replace. In his 7-point agenda, there are a few good things there that are, conservative. Other candidates, for example, not having an individual mandate, block granting Medicaid, expanding health savings accounts, allowing people to carry those forward and pass them on to their descendants. There are some good things there. I don't agree with the idea of a tax deduction as compared to age-based refundable tax credits. The thing that disturbs me is that he is saying that he supports drug importation from countries like Canada, and it just won't work. There are only 37 million people in Canada. It's fewer than in the state of California, and it's just not going to work. It hasn't worked before, and so and the other idea that I think that is bad is he wants to dictate drug prices between the federal government and the drug companies for those people enrolled on Medicare Part D, and that's something that Hillary supports, Bernie Sanders supports, and of course John McCain has supported.
So Betsy, on to you. Anything new?
Well, I think this is a very good start, and I'll tell you what it does. It totally repeals every word of Obamacare. That means it gets rid of the individual mandate, the employer mandate. It gets rid of the penalties on individuals and families and on employers. It gets rid of the concept of the one-size-fits-all government-designed health plan. You can buy whatever you want, and you can buy it wherever you want, not necessarily in your own state, if you can find a better deal in another state. Not only that, but it repeals 20 tax hikes and new taxes that are included in Obamacare, and it repeals the enormous cuts to Medicare that have made seniors suffer. Remember, one of the grave injustices of Obamacare is that it was paid for largely with cuts to Medicare. So seniors are big winners under what Donald Trump is proposing. Now, in addition, I think the tax deduction is a very good idea, and I hope that union members and other workers who have sacrificed wages in the past in order to get rich health benefits are listening. Because the fact is, Washington shouldn't be telling you how much you should pay for your health plan. Whatever it costs, it should be paid for with pre-tax dollars, yours or your employer's. So I like the tax deduction part of Donald Trump's plan. Some of the other candidates, I'm not working for any of those candidates. I'm a neutral in this horse race. I know many of the health policy advisors have actually signed up with a campaign, and they're advocating for Marco Rubio's tax credits. But the fact is that the best way to reform entitlements is not to keep creating new ones. And Marco Rubio creates a big, new, expensive entitlement. This nation is already facing what will soon be $20 trillion in debt.
Okay, let's go ahead and stick on Donald Trump's plan for a minute here, because I've only got 90 seconds left. Sally, when you look through this plan, do you see anything here that Donald Trump could have been more aggressive in doing that might have set him apart and made him unique? Because, quite frankly, a lot of people look at these and say, we've heard all these before.
Right, but I think it's important that he has finally come out with a 7-point plan, and I think it is a good start, as Betsy says. It'll be interesting to see in that Fox debate tonight. Does he stand by the plan? Does he talk about what is in his plan, and does he support it? Because we've seen him, as I say, all over the map on things. This is something that he can go by. It's a roadmap for him, and I hope that he's going to follow it.
Betsy, isn't that the biggest thing here? Donald Trump, like so many other politicians, let's be fair, he's changed his mind on many things. There have been backtracks, there have been flip-flops, but doesn't he have to convince people that this right here, this is exactly what I'm going to stick with and it won't change? That, I think, is a question a lot of people are going to ask. I got 30 seconds.
Yes, you are absolutely right, but keep in mind also he must work with Congress. Ultimately, repealing Obamacare depends on working with Congress, so he shouldn't be so stuck on a plan that he can't be flexible.
Sally, we got a little time left here. That's a good question to come to you, though. No one talks about that. Whoever the president is, better work with Congress. Do you see anything in here, 20 seconds, do you see that this could be pushed through Congress? Do you think it can be done?
Well, I think when you look at the poll numbers, that 54% of Americans would like to see Obamacare repealed and replaced. Their premiums are too high, deductibles are high, lower networks. So I think if the Republicans elect a president, if they have control of the Senate and the House, I think the mood is there for Congress to act and to do something that will repeal and replace Obamacare and get us off that road to a socialized healthcare system, such as Bernie Sanders supports, and like I grew up in Canada.
And he certainly has it right. Number one, completely repeal Obamacare. That's where you've got to start to make people happy. Dr. Betsy McCaughey, Sally Pipes, ladies, thank you so much for joining us. All right, from racing for the White House to racing headfirst into an automated highway accident. We'll talk about that with a car coach next.